If you take over-the-counter pain relievers, acid reflux medications, or even certain antibiotics, you need to hear this. These common drugs, often seen as harmless, could be slowly but surely damaging your kidneys without you even realizing it. Most people think prescription medications are the only ones to worry about, but that couldn't be further from the truth. In this video, I'm going to reveal 8 common medications that can silently damage your kidneys, explain how they do it, and give you crucial steps to protect yourself. Stick around, because understanding this could save you from serious health complications down the line. I'm Mary, and my goal is to empower you with vital health information. I've spent countless hours researching and consulting with medical experts to bring you insights that can genuinely impact your well-being. This isn't just about listing drugs, it's about understanding why and how to prevent harm. Before we dive into the list, let's quickly underscore why your kidneys are so incredibly important. They're your body's unsung heroes, filtering waste, balancing electrolytes, regulating blood pressure, and even producing hormones. They work tirelessly, 24/7, to keep you healthy. When they start to fail, the ripple effect on your entire body can be catastrophic. And often, kidney damage shows no symptoms until it's advanced. Now, a quick but crucial disclaimer: I am not a medical doctor. This information is for educational purposes only and should not replace professional medical advice. Always consult your healthcare provider before making any changes to your medication regimen. My aim is to make you aware so you can have informed discussions with your doctor. Medication number 1, NSAIDs, non-steroidal anti-inflammatory drugs. Let's start with number 1, a big one, NSAIDs. We're talking about ibuprofen, like Advil, Motrin, Naproxen, Aleve, and celecoxib, Celebrex. These are incredibly common for pain, inflammation, and fever. How they damage? NSAIDs can reduce blood flow to the kidneys, especially when used long-term or in high doses. They inhibit enzymes that produce prostaglandins, which are compounds that help maintain kidney blood flow. When that flow is restricted, kidney function can decline. This is particularly risky for those who are dehydrated, elderly, or already have existing kidney issues. What you can do: use non-steroidal anti-inflammatory drugs sparingly and at the lowest effective dose. Never exceed the recommended dosage. If you rely on them frequently, discuss alternatives with your doctor like acetaminophen, which has a different risk profile. Medication number 2, PPIs, proton pump inhibitors. Next up, at number 2, we have proton pump inhibitors, or PPIs. These are hugely popular for acid reflux, heartburn, and ulcers. Think omeprazole, Prilosec, esomeprazole, Nexium, and lansoprazole, Prevacid. How they damage? While extremely effective, long-term use of PPIs has been linked to an increased risk of chronic kidney disease. The exact mechanism isn't fully understood, but it's thought they might contribute to interstitial nephritis, an inflammation of the kidney tubules. There's also research suggesting they can interfere with magnesium absorption, which is vital for kidney health. What you can do: if you're on PPIs long-term, ask your doctor if it's still necessary or if you can transition to a lower dose or another treatment. Lifestyle changes like diet modifications can also often help manage acid reflux. Medication number 3, certain antibiotics. Coming in at number 3 are certain antibiotics. Not all antibiotics are kidney toxic, but some classes definitely are, especially when used in high doses or by individuals with pre-existing kidney conditions. Examples include aminoglycosides like gentamicin, tobramycin, some cephalosporins, and vancomycin. How they damage? These antibiotics can directly damage kidney cells, particularly in the tubules, leading to what's known as acute tubular necrosis. The kidneys struggle to filter and excrete these drugs, leading to their accumulation and toxicity. What you can do: always take antibiotics exactly as prescribed. Never self-medicate or take antibiotics for viral infections. If you have kidney issues, ensure your doctor is aware so they can adjust dosages or choose kidney-friendlier alternatives. Medication number 4, diuretics, water pills. Fourth on our list are diuretics, often called water pills. These are frequently prescribed for high blood pressure, heart failure, and swelling. Common examples include furosemide, Lasix, and hydrochlorothiazide. How they damage? While diuretics can be life-saving, they can also cause dehydration and electrolyte imbalances, particularly potassium and sodium. Severe dehydration reduces blood flow to the kidneys, increasing the risk of acute kidney injury. In some cases, specific diuretics can also directly affect kidney function. What you can do: if you're on diuretics, staying adequately hydrated, unless otherwise advised by your doctor for specific conditions, is crucial. Regular monitoring of kidney function and electrolytes by your doctor is also essential. Medication number 5. Certain diabetes medications. For number 5, let's talk about certain diabetes medications. While many diabetes drugs protect kidneys, some, in specific situations, can pose a risk. An important one to note is metformin. How they damage. Metformin itself is generally safe for kidneys and often beneficial. However, in individuals with already impaired kidney function, it can accumulate and lead to lactic acidosis, a serious and life-threatening condition. Other diabetes medications, particularly some older ones, might also require careful dosing or avoidance in kidney disease. What you can do: if you have diabetes, regular kidney function tests are non-negotiable. Your doctor will tailor your diabetes medications and dosages based on your kidney health. Never stop or start diabetes medication without medical supervision. Medication number 6, laxatives, especially stimulant laxatives. Coming in at number 6 are laxatives, particularly stimulant laxatives when used excessively or long-term. While generally safe for occasional use, chronic misuse can be problematic. How they damage. Overuse of certain laxatives can lead to severe dehydration and electrolyte imbalances. These imbalances, especially of potassium, can directly impair kidney function and, in extreme cases, lead to kidney damage. Some laxative preparations used for colonoscopies also contain phosphates that can cause acute phosphate nephropathy, a form of acute kidney injury. What you can do: use laxatives only when necessary and as directed. Focus on lifestyle remedies for constipation, such as increasing fiber, fluid intake, and physical activity. Consult a doctor for chronic constipation rather than relying on daily laxative use. Medication number 7 and number 8, herbal supplements and contrast dyes. For number 7, this one might surprise you. Certain herbal supplements. Just because something is natural doesn't mean it's safe for your kidneys. Some traditional remedies or unregulated supplements can contain heavy metals or compounds that are directly toxic to kidney tissue. Examples include aristolochia acid, found in some traditional Chinese herbal remedies. How they damage. The mechanisms vary widely depending on the specific herb or contaminant, but can range from direct toxicity to inflammation and scarring of kidney tissue. What you can do: always inform your doctor about all supplements you're taking, even natural ones. Research supplements thoroughly and choose reputable brands that undergo third-party testing. And finally, number 8, contrast dyes. These aren't typically medications you take at home, but they're crucial to mention because they're used in common imaging tests like CT scans or angiograms. How they damage. The iodine-based contrast material can be directly toxic to kidney cells, particularly in individuals who are already dehydrated, elderly, or have pre-existing kidney disease. This is known as contrast-induced nephropathy. What you can do: if you're scheduled for a scan involving contrast dye, ensure your doctor knows your kidney history. They may take preventative measures, like prescribing fluids before and after the procedure, or using a different imaging method if possible. So, to recap, the 8 common medications that can damage your kidneys are NSAIDs, PPIs, certain antibiotics, diuretics, specific diabetes medications, laxatives, some herbal supplements, and contrast dyes. The key takeaway here isn't to fear medication, but to be informed. Always discuss your medications, including over-the-counter drugs and supplements, with your doctor or pharmacist. Advocate for your kidney health. If you found this video valuable, please like, share, and subscribe for more essential health insights. And remember, knowledge is your best defense.